Everybody. I am Dr. Liz Marnik from Those Nerdy Girls and Science Whiz Liz. I'm an immunologist, an educator, and a science communicator, and today I am joined by Jessica and Kate from factcheck.org. Today we're going to help you separate fact from fiction when it comes to Mpox. Jessica and Kate, can you introduce yourselves?
Yeah, sure. So I'm Jessica McDonald. I'm the science editor for factcheck.org. And I have a science background, so I have a PhD in immunology. And after leaving grad school, I decided to pursue science journalism. And I joined factcheck.org as a science writer in 2018. And now I oversee our science coverage. So we have a team of 3 people, including me. And we do 2 main types of science fact checking. The first being factcheck.org's bread and butter, which is political fact checking. So our team will write about incorrect or misleading science and science policy related claims that politicians make, primarily at the national level. And then a lot of what we do now, especially since the COVID pandemic, is fact checking claims on social media. So a lot of that is health based about vaccines, infectious diseases, but we also cover topics such as climate change. And in addition to straight up fact checking, we also will write explainer type pieces just to help get accurate information out there on the science topics that we're interested in.
And I'm Kate Yandell. I am a staff writer for factcheck.org, focusing on health and science, and I've spent my career writing about science. So I wanted to start out, Jessica, by asking you, why is Mpox in the news? And can you give a little background on what is going on with Mpox?
Yeah, absolutely. So, Mpox is a viral disease that's caused by the monkeypox virus, which is a type of orthopox virus. It's related to, but much less dangerous than the virus that causes smallpox. It's somewhat similar, though, in terms of the presentation of the disease. So, there is this characteristic rash. It goes through different phases, but it does have these blister filled lesions, which can help spread the virus if you touch them. It can be quite painful. Most people are very uncomfortable, but they don't necessarily get seriously ill. However, some people do get very ill, typically immunocompromised people or children, and some people do die. So most people probably remember Mpox from 2022. Back then, we were calling this disease monkeypox. So around that time, scientists decided to rename the disease Mpox to reduce stigma. The virus, though, is still called the monkeypox virus. And what was happening then was an unprecedented spread of Mpox around the world. So in the past, Mpox really didn't get very far. So typically, what happens is that someone contracts the virus from a wild animal, usually some kind of rodent, and that can be through an encounter with an animal, a scratch or a bite, also through eating undercooked bushmeat, anything like that. The virus can then infect a person. And then once the person is infected, they can infect others. The lesions on the rash, for example, are very infectious, so you don't want to touch them. But usually, transmission requires close contact. And typically, you'd have these little outbreaks, but they'd fizzle out because it's relatively hard to spread. And then what was unusual in 2022, what everybody heard about then, was that you started seeing this much more extensive spread through people, and specifically through sexual contact and the sexual networks of men who have sex with men primarily. Other people could get it. It's not like it was limited to only that group of people, but it was mostly being spread through close sexual contact and in that group of people. So now Mpox is back in the news. The outbreak from before is actually still ongoing. We just don't hear about it as much. And that's because cases in the US and Europe are down significantly from what they were in the summer of 2022. What's new is this big uptick in cases in the Democratic Republic of Congo and some other nearby African nations. And this time it's also a different type of the virus. So there are 2 main types or clades of the virus. And this ongoing outbreak, the global one, was clade 2. And so this increase that we're seeing now is in clade 1, which has never been seen before outside of certain parts of Africa. And clade 1 has historically also been more severe than clade 2, although there have been signs so far that the current cases that we're seeing haven't been quite as deadly as the past numbers would suggest. So it's still a little unclear, but there is this concern that what we're dealing with is perhaps slightly more lethal than what we saw before. So Liz, I was thinking you could actually just say why we've really heard about it in the news, which is, why did the World Health Organization declare a public health emergency?
Yeah, so I think a lot of people probably weren't aware that this had been happening in certain countries in Africa until that declaration from the World Health Organization. And the WHO declared what we call a public health emergency of international concern. And this is due to kind of what you were just talking about. There are multiple Mpox outbreaks happening in certain countries within Africa, and especially in countries that we didn't typically see this happening. And this is kind of also partially due to what they're calling an extraordinary event. And this is actually the emergence of a different type of monkeypox. So Jess mentioned how there are two types, clade 1 and clade 2. And we now see a new mutation within clade 1 that they're now referring to as clade 1b. And this virus seems to have mutations that allows it to be better able to spread human to human. So it seems to be transmitting a little bit better human to human. So once those cases started increasing, once that mutation was identified, this public health emergency of international concern declaration helps get access to those countries experiencing this outbreak for the resources that they need. So this really is there as a tool for the World Health Organization to use to ensure that countries in Africa experiencing this outbreak have the public health infrastructure support to help them deal with this outbreak. Okay, so Kate, I have a question for you next. Could you tell us more about where these Mpox outbreaks are located?
Yeah, I think one of the complicated things for people to wrap their head around with the current Mpox outbreaks is that there are multiple of them in different geographical areas. And so as we talked about, the global Mpox outbreak from 2022, this is the clade 2 outbreak. This is still ongoing. So there are still these clade 2 cases around various countries in the world, including the US. However, we have also the clade 1 outbreaks, which have been divided into clade 1A and clade 1B. And these are centered in Congo, otherwise known as Democratic Republic of Congo. There has been some new outward spread of clade 1 cases to places that hadn't seen them before, both within Africa and some one-off cases internationally. And so I wanted to talk about clade 1A. These are in the western central parts of Congo and a few other nearby countries. These are all countries where clade 1 Mpox has been seen before. And many of these cases are in children, which is also in keeping with what we've seen in the past. And also in keeping with what we've seen in the past, these are usually being spread from an animal to a person, and then some limited transmission will happen, such as within a household, but not seeing that sort of sustained transmission pattern. That said, the fact that we're not seeing this new sustained transmission pattern, or the fact that some things about 1A seem more familiar, doesn't mean this outbreak isn't important. It actually is the bulk of the cases driving this big increase in cases in DRC. And this has been increasing for multiple years now for various complicated reasons. So yes, clade 1A important, clade 1B also important. Mpox was historically pretty rare in Eastern Congo, and this is where clade 1B has emerged. It was first described in a mining area with a lot of cases in adults, including sex workers in 2023. And as Liz mentioned, it is undergoing this more sustained spread in people. It's still spreading in Eastern Congo, but it also has spread to 4 other African countries, and also has caused these isolated cases in Sweden, Thailand, and now most recently India. And then again, because nothing about this is simple, it's not as simple as just saying clade 1A is in kids, clade 1B is in adults, or saying clade 1B is an STI, clade 1A isn't. There have been these 1B cases spreading in camps for displaced people and affecting children, people of various ages, and also a substantial number of cases in Burundi, which has a really concerning outbreak of 1B Mpox, have been in kids. So I wanted to now let Liz talk a little bit more in detail about how Mpox is transmitted.
Yeah, so we kind of touched on this a little bit already, but I think it's important to kind of talk about it more since it is a thing that a lot of people are concerned about. So, as both Kate and Jess have mentioned, the primary mode of transmission, the primary thing that's driving these cases are contact with people who are infected or animals that potentially have the infection. So this could be contact through household interactions, this could be contact through sexual interactions, this could be contact with an infected dead animal. Those direct types of contact seem to be driving the transmission the most. Now, I get a question a lot from people about whether or not we need to be worried about airborne transmission of Mpox. And there is some evidence from other viruses in this family that airborne transmission is theoretically possible. But I think it's really important for people to remember that just because something is theoretically possible does not mean it's probable or what is currently driving cases. So while yes, theoretically this is a possibility, the evidence that we have right now does not support that this is a main driver of cases happening currently. So right now it really is direct contact with people who are infected or with animals who are carrying the virus. So that leads me to the next question for Jessie. So what is the current threat level for Mpox, and can you explain who is at greatest risk?
Right. Yeah. So, there is a possibility that clade 1 mpox will spread more broadly, particularly if the outbreaks in Africa aren't controlled. And that's a really big reason about why the World Health Organization has declared this public health emergency. No one wants to see, a repeat of what happened with clade 2, with clade 1. But as of right now, clade 1 cases have not been identified in the US or Canada. There really have only been a few imported cases in countries outside of Africa. I think it's 3 currently, could change at any moment, but relatively small, very small number. This is mostly limited to Africa right now. And the most recent assessment from the US CDC as of the end of August was that the risk of clade 1 mpox to the general population is low. And the risk is slightly higher for groups of people who have been at higher risk of Mpox already this whole time. So the CDC says the risk to gay, bisexual, and other men who have sex with men who have more than one sexual partner and people who have sex with these individuals is a low to moderate, so a slightly higher risk assessment. And Canada's latest risk assessment reached similar conclusions. And again, while clade 1 hasn't shown up yet in most places, clade 2 is still circulating at relatively low level in the US and elsewhere. So it's something to be aware of, but mostly for high-risk groups. I'll add that the CDC has also said that even if there are some imported cases of clade 1, the agency doesn't expect to see as much spread as what's happening in Congo. And that's because prevention and treatment should be better here, and the impact should also therefore be lower. Which brings me to how people can prevent and treat Mpox.
Yeah, and I can talk about that a little bit. So in terms of treatment, with the clade 2 Mpox outbreak, we did use an antiviral called TPOXX. However, unfortunately, there was recently a clinical trial done in Congo treating people hospitalized for clade 1 Mpox, and that did not show success of this antiviral in treating clade 1 Mpox. So it would be great to have antivirals. However, this trial showed something that I would say isn't necessarily surprising, but is really important, which is that people in the trial overall, regardless of whether they got the antiviral, they died at a much lower rate than has been seen typically in Congo, at a rate of 1.7% as opposed to 3.6% or higher. And that was simply because they got good basic supportive care. This would be things like getting IV fluids, having wound care for lesions to keep them from getting infected, managing complications. So this really just shows that if we can provide better basic care to people around the world, that can really reduce the fatality rate. In terms of prevention, there are Mpox vaccines. The access to them has been, as one of my sources put to me, non-existent in Congo and other African countries, even though there has been this substantial burden of Mpox. This is starting to change very recently. since the public health emergency has been declared. Some things that people also emphasized to me that were really important were just having access to tests to know if people had Mpox, and also having good communication to people on what to watch for, what to do if they learned that they might have Mpox or suspected they might have Mpox, and also just basic research to understand truly how it is being transmitted and what's driving the current patterns we're seeing, so that we can better respond to it. I also wanted to pivot a little bit to the US since that's where we are. So vaccines are readily available in the US for eligible people. That would include people who are men who have sex with men or are gender diverse and have had recent sexual practices or recent sexually transmitted infections that put them at a little higher risk. You can sort of see what those are on the CDC website. Or if someone has had intimate contact with someone who fits the description of high risk, or if someone knows that they've recently had intimate contact with someone with Mpox, you can actually get it after the fact really quickly to try to mitigate that. So the data I've seen from 2023 indicates that just 23% of at-risk people were fully vaccinated at that point. So there's definitely room for improvement in terms of coverage in the US. And I also did just want to highlight very recently that there's some new travel guidance for people going to DRC or other countries with sustained spread of clade 1 Mpox, regardless of sexual orientation or gender identity, that if they're going to be engaging in certain sexual activities, such as sex with a new person, that they should get Jynneos, which is the Mpox vaccine that is given in the US. So I wanted to we all wanted to talk a little bit about some Mpox myths and misconceptions that we've seen being spread online. So I thought that Jessica could start by talking a little bit about some vaccination-related posts that we've seen.
Yeah, so several of the claims that we've seen actually work in misinformation about COVID-19 vaccines. It's kind of interesting. A couple different posts have essentially pointed to Mpox cases and the rash. Sometimes there's like a picture involved here, and they suggest or outright state that the Mpox rash, isn't really Mpox at all. It's a side effect of the COVID-19 vaccines. This is incorrect. So one example in particular is very interesting to me because it draws on this regulatory document that I've seen before in my fact checking. So it's this regulatory document from Pfizer, and it's a very long list of conditions that people are monitoring for after vaccination in case the vaccine were to cause them. And these are called adverse events of special interest. And again, the document is just saying, here's this list of things we'll be looking for, a ton of things. We're looking for all these things because we want to be complete and make sure it's safe. But people opposed to vaccination, they have looked at this list and they have misinterpreted it, and they have done so for a while, as saying that all these things on this list have either been observed after vaccination or even shown to be caused by vaccination. And that's just not what this list is. And so this one post that we saw cites this regulatory document, which happens to list a condition called autoimmune blistering disease, claims it's a reaction to the Pfizer vaccine. And because it's this skin condition, tries to say that it's something that could be confused for Mpox, and therefore Mpox is a cover-up for this vaccine. So it's a little convoluted, but it's just not plausible, that Mpox could be covering up this condition, not to mention that research actually suggests that this particular condition is not caused by vaccination, and it's already very rare. So none of these pieces sort of fit, and yet this is something that we're seeing spreading about this. But it is sort of an interesting example about the sort of misinformation about Mpox sort of colliding with the classic things that we've seen about COVID-19 vaccine misinformation. And, a lot of the other misinformation that we've seen about Mpox is sort of related to the World Health Organization and their public health emergency, which Kate is going to talk about a little bit briefly later. But Liz, I was thinking maybe you can clear up this another point of confusion that we've also seen, I think a lot of people have, which is just, does this public health emergency of international concern, does it mean there's another pandemic like with COVID?
Yeah, and I think a lot of people are probably still a little bit traumatized from the last 4 years, right? So whenever there's a new alert from the World Health Organization, people get very stressed. And I think people don't realize that there is a difference. So when a pandemic is declared, there are certain conditions that have to be met. And the primary one is that there is uncontrolled spread throughout the whole world. And we are not seeing that with Mpox. The public health emergency of international concern, as I mentioned earlier, is really a tool that the World Health Organization uses as a way of trying to get resources to the countries that need them. In this case, there are countries within Africa who have been having Mpox outbreaks for years, but have not been able to contain it or control it because they don't have access to vaccines. So, by using this declaration, the World Health Organization can then help get that support to the countries that need them. So this is a way for them to utilize and mobilize the other countries like the US and other countries sending support to Africa, but it does not mean that this is a pandemic. These are completely different things. So Kate, do you have a myth or misconception that you'd like to share with us?
Yeah, I just wanted to talk more generally about another sort of crossover claim that we've seen with COVID-19, H5N1 bird flu, the last Mpox public health emergency, and now with this most recent declaration by World Health Organization of the Mpox emergency. There just tends to be a sort of concerning pattern of conspiratorial thinking. There can be variation in who the conspirators are or what they're doing. Often the players do include supposedly, baselessly, the World Health Organization, Bill Gates, various governments such as the US government, or just like they. Sometimes it's a little unclear. And supposed goals include forcing people to wear masks or get vaccines, establishing a global government, they're influencing elections, various like very sweeping and very not really supported by evidence ideas. And I guess I just wanted to emphasize, as you run into perhaps that kind of misinformation about this outbreak, is that the reality is often the efforts that are being portrayed as somehow nefarious are actually efforts to be prepared for future spread or to get access and equity and access to resources, to things like vaccines. It's not so much about forcing people to take public health measures as making sure that people who don't have access at all have the option of even having a tool to deal with the disease. And so that is my myth or misconception I wanted to highlight. And I'm going to let Liz make a few closing comments.
Yeah, and I think that's kind of the thing that I wish people would remember when these types of things happen, is I think that there is this inherent disposition that, like, unless you feel like it's going to directly impact you, you don't necessarily care. And Mpox has been circulating in Africa for a while now, as we've all mentioned before in some of our answers. And if they had the resources, if countries like the US and other more wealthier countries helped them contain this outbreak, we probably wouldn't be where we are today. So the World Health Organization has to use these types of tools as a way for kind of getting the rest of us to care about what's happening in these other countries. So I hope that a lesson that we can all learn from this is that we really need to care about public health, even if it isn't directly impacting us, even if it directly isn't impacting America or Canada or wherever you're watching from. And that's because if anything that the COVID-19 pandemic has taught us, it's that viruses do not respect borders. Infectious diseases don't understand that, hey, this country is over here, we're over here, I'm going to stop at this border. That's not what happens. So if we invest in the resources to make sure there is global vaccine equity, that there is these resources in other countries, then we can avoid getting another pandemic. we can avoid some of these issues. So I'm hoping that that is a lesson that we'll learn, that while we currently do not have to worry about Mpox here in the United States, we should worry about it for the countries that need these resources, and we should advocate for them having access to those resources. And would you two like to talk a little bit about, in closing, things that we can look out for being better consumers of information and avoiding some of these misinformation traps?
Yeah, I think that something I often bring up in this sort of venue is just when you're looking at social media or social media posts, you can ask yourself some questions like, is this really playing to your personal fears? Are you having an extremely strong emotional reaction to like fearing for your personal safety? I mean, that doesn't necessarily mean the information you're reading is wrong, but I think it's just a reason to step back, take a breath, and like assess whether it is a reliable piece of information. Ask a few questions about it. I mean, we also see posts trying to sell things sometimes. Like, for instance, if you see someone trying to sell you something to like prevent you from getting sick from an outbreak, that I think is some reason for like suspicion. A lot of the things we've seen being sold are not necessarily going to work, and you'll just spend a lot of money on them. Um, and then just also like looking out for oversimplification. I think as we demonstrated, like these outbreaks are pretty complex, and there's a lot of information that's still being found out. So if someone is claiming they have all the answers and scientists don't, or something like that, that's a little bit concerning. And also, I've seen a sort of concerning pattern specifically with this Mpox outbreak of people trying to discredit scientists who are trying to present complicated information or potentially changing information on the basis of it being sort of confusing or it seeming like it's shifting. And I think that that's usually probably not a good reason to discredit someone. That probably means that they're really trying to engage with the facts on the ground and get you the right information. In a lot of cases with this kind of communication. So yeah, those are sort of my takeaways on navigating that.
Awesome. So thanks, Jessica and Kate, for teaming up to educate about Mpox today. And thank you to all our audience for tuning in. We're glad we were able to answer some of your questions. And to stay in touch with those nerdy girls, you can sign up for our newsletter on Substack. You can also follow us on social media. We have a question box that you can submit on our website. And you can follow my account at ScienceWizLiz on social media and primarily Instagram and Facebook. And then how can people stay in touch with Fact Check?
Yeah, so you can check us out on our website. It's exactly what it sounds like. It's factcheck.org. We also have a newsletter you can sign up for on our website. It's sent weekly. We give a recap of things that we've covered for the week, also with some interesting tidbits thrown in, how we get our information. We usually highlight a reader question that we've answered, that sort of thing. It's just a very short, fun little newsletter you can sign up for. It usually comes on Friday. We're also on Facebook, Instagram, and X, and you can email us at askscicheck@factcheck.org. And you can also, those would be for science related questions. And we try to respond to people who write in. And then when several people will have the same question, we'll actually write a whole story about it, answering that question that gets published on our website under our Ask SciCheck feature.
Awesome. Well, thank you both again for your time, and thank you all for listening. Have a great day.